All right, thanks for joining us for our COVID-19 media update for today. With us, we have Dr. Rachel Herlihy, State Epidemiologist for CDPHE, and Scott Bookman, COVID-19 Incident Commander for CDPHE. And with that, we're going to go ahead and start with Dr. Herlihy.
Great, thank you so much. Good afternoon. So what we are seeing right now is really a mix of promising trends, but also some new challenges that are presented to us by the Delta variant. And so I want to walk you through the data that we are currently seeing. So starting here where we normally do, this data is showing you our case trends over time. So each of those gray vertical bars represents daily case rates. And then the red line is showing you our overall 7-day moving average, which is how we sort of smooth out some of that daily variability and really try and understand what overall trends look like. And so looking at that red line, what you see here is a steady decline in cases occurring in the state. You can see that that line is not quite as steep as it was a couple of weeks ago. So while we're continuing to see a decline in cases, that decline isn't quite as fast as it was earlier in the spring. But certainly we continue to move in the right direction as far as case counts in Colorado. Next slide. There is some variability, though, that we are seeing across the state right now. And that variability, based on the data that we're seeing, we believe is really influenced by two main things. One is current vaccination rates by county or by region, and then also by variant trends that we are seeing in particular regions of the state right now. And there's a lot of variability in that variant data. And obviously, of course, there's variability in the vaccination rates across the state right now. So two regions in the state where we are starting to see some trends of increasing cases, higher rates of cases are the western slopes. So you can see all the way down from Moffat County to San Miguel, Dolores, Montezuma, all counties where we're seeing some higher rates of disease right now compared to other parts of the state. We're also seeing some increased rates in the San Luis Valley in certain counties. So two regions where we're seeing trends are a little bit different. I'm also seeing a little bit of clustering of increased rates around El Paso County, but not to the same extent that we're seeing in some other parts of the state right now. Next slide. So I want to talk a little bit about the Delta variant and the impact that it is having on Colorado right now. So just to refresh you, the Delta variant, also known as B.1.617.2, is the variant that was first identified in India in late 2020. It was identified in Colorado first in Mesa County in early May. The proportion of cases due to this Delta variant in Colorado have been steadily increasing and are now estimated to be about 40% of cases occurring in the state. We've seen that rise really pretty rapid in Colorado. It's not surprising because what we know about this variant is that it is much more transmissible than other types of SARS-CoV-2 virus, the virus that causes COVID-19. We estimate that it's probably about 50% more transmissible than the Alpha variant or the UK variant. And that Alpha or UK variant was already more transmissible, probably about 50% more transmissible than other types of SARS-CoV-2 virus. So it's more easily spread from person to person, meaning that if you are unvaccinated and exposed to COVID now, your chances of becoming infected are much greater than they were earlier in the pandemic. Also, uniquely right now, we're seeing that nearly all of the cases in Mesa County appear to be due to this Delta variant. So Delta variant was first identified in Mesa County, and the rates are pretty high right now in Mesa County compared to other parts of the state. And we think that's probably due to two factors. One is going to be lower vaccination rates, and the second is going to be due to the overall increased proportion of cases due to Delta variant compared to other types of SARS-CoV-2 virus. We also know that some data coming out of the UK suggests that the Delta variant is causing more severe disease. In fact, what we're seeing is about double the hospitalization rate due to the Delta variant compared to previous types of COVID-19. So certainly a concerning trend there as well. So again, if you were exposed to COVID-19 now and become infected, your chances of being hospitalized now are much greater than they would have been earlier in the pandemic. And then finally, vaccine effectiveness is slightly lower. So while we continue to see really highly effective vaccines, and thankfully we're starting with these really highly effective vaccines for the mRNA vaccines, that's in that 90 to 95% range. But we are seeing a little bit of an impact to vaccine effectiveness with this Delta variant. So with the Pfizer data that we've seen coming out of the UK, we're estimating that that decrease is probably from about 93% with the Pfizer vaccine against the Alpha variant or the UK variant, down to about 88% with the Delta variant. So again, continues to be incredibly high. Again, continue to be some of the most effective vaccines that we've had in history, but are seeing a little bit of a decrease there as well. Next slide. And so looking at the overall proportion of variants that we are seeing here in Colorado, this is data that shows you each of the different types of variants of concern and how common they are and what the trends have been over time. So what you'll see here is that in the last couple of weeks, we have seen a pretty rapid increase in that B.1.617.2 or Delta variant. It's shown in that light green color here. So you can see week over week, we're seeing a pretty steady and rapid increase, now representing about 40% of all of the cases that we're performing sequencing here on in the state. And you'll see that, we're getting close to a place where probably in the next few weeks, we expect that Delta variant to become the predominant variant. We expect that proportion to continue to go up and probably exceed that UK variant in the next couple of weeks. Next slide. Here's similar data showing you overall national data and the overall distribution or proportion of these variants that are being seen across the US. So what I want to draw your attention to is the figure on the left, and this is CDC data. And what this is pointing out is that the overall proportion of Delta variant in the US overall is about 10%. So that last slide I showed you that here in Colorado, it's about 40%. In the US, it's estimated to be about 10%. The areas where we're seeing the most Delta variant in the country right now are Region 8, which is this upper, sort of central mountain region where Colorado is located. And then also that Region 7 just to the east of our Region 8. So those are really the two regions in the country right now where that proportion of Delta variant is the highest. Next slide. And in fact, Colorado actually, based on the most recent data that's on CDC's website, has the second highest proportion of Delta variant cases occurring compared to any other state. The only state that has a higher proportion right now than Colorado is Missouri. And again, Missouri is part of that Region 7. So you'll see that our part of the country and just east of us continues to be impacted more heavily by the Delta variant than other parts of the country are right now. But we expect that to probably continue to increase. We're going to see a continued increase in the proportion here in Colorado, and we expect the same trend to probably hold true throughout the country. Next slide. But as I've mentioned, vaccines continue to be highly effective. And this is data that we produce that tracks the overall vaccine effectiveness against being reported as a case here in Colorado over time. So you can see that we continue to see high levels of effectiveness in all age groups for the vaccinated population here in the state. So you'll see a range of 91 to about 94% vaccine effectiveness based on our most recent data. So again, even though we are seeing some level of decreased effectiveness against this Delta variant, based on the data that's coming out of the UK, overall, the vaccines continue to be highly effective and working very well against the Delta variant. Next slide. Finally, I want to present some of this data that we are tracking where we look at the correlation between hospitalization rates and our up-to-date vaccination rates. And so what we expect to see here is a diagonal line where we see the close correlation between high hospitalization rates and low vaccination rates, and then high vaccination rates and low hospitalization rates. So you'll see that the counties where we tend to have lower vaccination rates tend to be the counties where we see the highest hospitalization rates. And you can see that the counties in contrast where we have the highest vaccination rates tend to be the counties where we have the lowest hospitalization rates. Again, this clear correlation between vaccination rates, case rates, and hospitalization rates. There's a couple of counties that stand out here. You can see Mesa County and Garfield County. As I mentioned at the beginning, Mesa County is of course the county where we're seeing the highest prevalence of the Delta variant right now. And as I also mentioned, we know that the Delta variant does cause higher rates of hospitalization. And so that is probably explaining the trend that we're seeing here, where Mesa County's hospitalization rates are higher than we would expect them to be for the amount of disease that they have and for the amount of vaccination that they have. Also, you'll note, though, that the vaccination rate in Mesa County is lower than most parts of the state, and that's also explaining some of the higher hospitalization rates that they're seeing right now. Garfield County, right next door to Mesa County, we also believe that there's probably a fair amount of Delta variant being transmitted in that county. And with that, I'll hand it over to Scott.
Thank you, Dr. Hurley, and thank you all for joining. So as Dr. Hurley talked about at the beginning here, we really are seeing two different trends across our state right now. And when you look at our hospital utilization, and in particular our ICU beds, when you look at our statewide numbers, you continue to see ICU bed utilization decrease as you see vaccine rates increase across the state. However, when you look specifically at the Western RETAC and the Northwestern RETAC, we are seeing an increase in utilization of ICU beds, which means that we have fewer beds available as the days go on. We are carefully monitoring this situation to ensure that we have hospital capacity in that region, to ensure that we are not at a point where we need to start thinking about moving people from the Western Slope to other hospitals across the state that might have greater capacity. But this really does reinforce what we are seeing, which is that these vaccines are incredibly effective, even against this Delta variant. And in parts of the state that have higher vaccine rates, we are seeing lower rates of hospitalization and therefore more healthcare capacity for everybody who might need it. Next slide, please. And so in that vein, our goal as a state is to ensure that all Coloradans understand that this vaccine is free, that it is effective, and we want to make sure that everybody knows where they can go to get it and have their questions answered if they have any. So starting today, we have started making outbound phone calls to Colorado residents 18 and older who have not yet received their COVID-19 vaccine. We also know that it is important to bring this vaccine to meet the underserved and hard to reach where they are. And so we continue to add mobile resources, such as our buses, to go out into the community and vaccinate people where they are. Also, as part of our standard reminder recall process, we will be sending out text and email notifications to all people between the ages of 18 and 29, where our records indicate that they have received their first shot, but are overdue for their second COVID-19 vaccination. And I'll take a moment to reiterate here how important completing this series is. This vaccine is incredibly effective. It is significantly more effective when people receive both their first and second dose of the Pfizer and Moderna vaccine. In addition to that, we're sending out mailers promoting our $1 million drawings, and those have gone out to 1.4 million Coloradans. And then starting on June 19th, we began sending text messages to almost 500,000 people who are on our mailing list for whom we have a working cell phone number. So really, we are trying to reach people in every way possible to ensure that they know where they can get this vaccine and to answer any questions that they have. Next slide. Thank you.
Great. And so with that, we'll move to the media Q&A portion. Same as usual, we'll go ahead and use the raise hand function. I'll call on you, and if you could say your name and your outlet. And we would love to start with first questions first, so we can get through as many of you as possible before we go to follow-up questions. And so with that, let's start the first round with Meg.
Hello, can you hear me?
Yes.
Great. I wanted to ask about, I was looking at the variant data that's on your dashboard, and it showed a big jump in variant cases between Tuesday and Friday. And I just wanted to know, did you load a bunch of back data in last week, or are we really seeing that many more variant cases?
This is Rachel, I can take that question. So I do know that there was an issue with one of the runs in the prior week. So it could be that we had a larger batch of results than usual that were reported. But in general, the sequencing work is done in batches. And so we do typically have a large number that is released every several days. So it's not something where the numbers are changed necessarily on a daily basis because of how the work is done. But we can certainly get back to you on specifics there and make sure we can clarify any data issues that were involved. I'm not aware of anything other than a batch that I think we had to repeat.
Thank you.
Great, thank you. Marshall.
Hi there. I have a question about the phone calls story going out today, and actually a new question based on that slide that I was unaware of about the text messages. But the phone call question is, for people who have signed up for the no call list, how does this fit the essence of the no call list? People getting an unsolicited phone call for something that perhaps they've already made a decision about. And then Scott, if you could talk about what that text message and the 500,000 on your mailing list refers to, what mailing list is that? And then one follow-up based on the answer.
Yeah. So what we have done is we've looked into SIS, so our Colorado Information System, and for all Coloradans who are over 18 who have a record in SIS but do not have a record of COVID vaccine, we are reaching out to them. We know that this vaccine is the key to ending this pandemic. We know that this vaccine will keep people from being hospitalized and people from dying. And so we are doing all that we can to reach out to Coloradans to make sure that they have all the information that they need to make the decision that is best for them.
And then the mailing list, was that part of SIS?
Yes, all the information is coming from SIS and then other publicly available records.
So then the follow-up is, how can we be assured that the data is only being used for this purpose and not being sold or marketed for any other reason?
Marshall, I'm sorry to cut you off, but I really want to get through everyone's first question. We can take your follow-ups though through mediainfo@state.co.us. All right, John, I'm going to go over to you.
Hey, John Frank here from Axios Denver. I would love an answer to Marshall's question, so I'll make that my question, please. Thank you.
All of this information is being used for the sole purpose of reaching out to people to make sure that they have the information that they need to make the right decision for themselves and their families about this vaccine. We have statutory limitations on how we can use this information, and we're only using it to reach out to people to make sure that they understand where they can get this vaccine and to answer any questions that they might have.
Great, thank you. Stephanie.
Hi, good afternoon. This is Stephanie Rodriguez with Telemundo Denver. My question is very similar. Our audience is mainly Spanish-speaking, undocumented immigrants. So how can we relay this information, and that if they do receive a call or a text message, that their information is secure? And also, how can they understand where you guys got this information from?
So we really want to be upfront and open and really work with you all to ensure that the public understands why they're getting these calls. And so we really do want Coloradans to understand that their information is safe, it is secure, that it is the state reaching out to them to provide them with information. Additionally, any other providers where people may have received care may also reach out to them. This is an all-of-state effort. We have pharmacies, we have healthcare providers, we have regional accountable entities through the Medicaid system, are all working to increase vaccination rates, particularly in those who are most vulnerable. And so there is an enormous amount of outreach going on right now through all of these channels to ensure that Coloradans have all the information they need to make the right decision for themselves and their family.
Great. Do we want to, let's see, any other first questions before we go to follow-up? All right, so Meg, I'm going to go ahead and go over to you.
Thank you. My is with the Delta variant being more transmissible even than the previously more transmissible version, and having the vaccines, or at least Pfizer, having slightly less effectiveness. Is there anything people should be doing differently than what they're doing now, particularly vaccinated versus unvaccinated people?
Yeah, so I think that's an important question. So we know that unvaccinated individuals are more vulnerable than before if they are exposed to COVID-19. And so that means that they're more likely to be infected if they have an exposure because this virus is more transmissible. In addition, based on that UK data, we know that unvaccinated individuals are probably twice as likely to be hospitalized now compared to if they had been infected earlier in the pandemic. And so because of that, it's really important more now than ever that unvaccinated individuals have the information they need to make a decision around vaccination and ideally seek to be vaccinated to protect themselves, to protect their family members, to protect their community. In lieu of vaccination, though, the strategies that we have been using, that we had in place prior to vaccine becoming available, continue to be really important for unvaccinated individuals. And obviously, of course, that's going to include children who are not yet eligible. So it's incredibly important that unvaccinated individuals continue to wear masks indoors, continue to socially distance, limit their exposure to large groups, crowds. All of those things continue to be really important and as important now as they have been throughout the pandemic.
Thank you.
Great, thank you. And John Daly. I'm gonna go to your first question.
Okay, can you hear me okay?
Yeah.
Okay. So question regarding the Delta variant and the type of vaccine, given the transmissibility of the Delta variant, has that changed your thinking about whether it's better to get Pfizer or Moderna or J&J vaccine? Which ones seem best suited to deal with that variant? Do you have any view on that?
Yeah, I think that's a good question. So, at this point, the best data that we have on vaccine effectiveness in the Delta variant is coming out of the UK, where we don't have direct data on the Johnson & Johnson vaccine. The best data we have is really going to be for the Pfizer vaccine, which is closely related, of course, to the Moderna other mRNA vaccine. And so those are the vaccines where we really have the most direct information. We do expect that there probably is some level of impact of vaccine effectiveness with the Johnson & Johnson vaccine. We know that the Johnson & Johnson vaccine effectiveness is slightly lower than what we've seen with the mRNA vaccines, Pfizer and Moderna. So still incredibly effective, but probably a little less effective than some of the mRNA vaccines. Of course, the benefit of the Johnson & Johnson vaccine is going to be that it's a single dose and you can get that full protection sooner. So there's really trade-offs, I'd say, between the two vaccines. And again, we don't have a ton of direct information or data on that Johnson & Johnson vaccine with the Delta variant at this point.
Great, thank you. John Frank.
Thanks. I'm wondering if you can give more information about how many people didn't get their second COVID shot. You said you were making, I believe it was calls or either text messages directly to them. What percentage of people haven't gotten their second shot, and how many people is that? Can you add some numbers to that, please? Thank you.
The specific numbers I'll have to have Heidi send over to you afterwards. We'll follow up with that. But historically, as part of our immunization program, we always evaluate how many people complete their second dose. And so we really look, and anybody who doesn't have a record of a second dose of this COVID vaccine, we're going to reach out to them and make sure that they know that they need it. And again, answer any questions if they have them about where they can go and get it.
And if I can add just one more thing to that, I guess I want to emphasize too that the second dose is more important now than ever before, because what we've learned from the UK data is that that second dose is incredibly important to make sure that individuals are protected against this Delta variant. With just one dose, that's really where we're seeing that biggest gap in vaccine effectiveness. And so that second dose is really needed to ensure that people are protected from the Delta variant. We're not confident that they are protected from just one dose of the vaccine, of those mRNA vaccines with the Delta variant. So again, that second dose is incredibly important.
Great, thank you. Any other final questions before we end for today? Yeah, Shannon, if you could say which outlet you're with. Shannon, I don't believe we can hear you.
Yes. So yes, I was wondering, are there any special outreach efforts in particular to really convince people in Mesa and Garfield counties to get vaccinated now that it's evident that the Delta variant is such a concern there? And of the data that you have with breakthrough cases, how many deaths have there been with people who are fully vaccinated in those counties?
I'll take the first half of that question, then I'll turn it over to Dr. Hurley to see if she has an answer for the second half of that. And so, we're really partnering with Mesa County Public Health. They've been wonderful partners in this effort, and we really are doing all that we can to increase our messaging out in Mesa County. Some of us are headed out there tomorrow to meet with local elected officials in the community to really do all that we can to ensure that people are aware of how important this vaccine is. As I said, we added these mobile buses so that we have more access in our rural communities where we have the ability to bring vaccine to people. And it's part of our outreach efforts as well, as we want to make sure that everybody who doesn't have a record of having received this vaccine yet has all the information that they need to make a decision, and they know where they can go to get this vaccine, which is free.
Great, thank you. And we're going to go ahead and wrap up for today. And so I just want to say thank you for joining us. And if we did not get to your question, or if you have a question you think of later, please send that over to media_info@state.co.us. And I'd love to thank our presenters as well as our interpreters. And I hope you all have a great rest of your day.